fam. Welcome to Healing Not Heal, where we will talk about all things mental health and holistic wellness in a very transparent and culturally competent space. Today, I wanted to dig deep into a conversation that impacts our mental health and our lives. So this is a much needed, urgent conversation that is often overlooked in a lot of communities because if it doesn't affect you directly, then, out of sight, out of mind. But I wanted to talk about how poverty and inequality impact mental health and physical health, the access to services, and the stress that it imposes on those that suffer through poverty. We often hear the phrase, health is wealth, right? But what happens when wealth isn't an option? What happens when there are systems in place that keep people struggling no matter how hard they work? Today, we will explore the hidden cost of poverty, the silent toll of inequality, and hear directly how it has impacted my life as someone who has experienced it as well. We will also talk solutions because while there is problems, we also want to offer solutions and see how we can make impacts that change our community. So let's start with some facts. Did you know that those living in poverty are twice as likely to experience depression and anxiety compared to those living above the poverty line? It's not just about money. It's about chronic stress, constant uncertainty, feelings like you're running on empty. Think about that. If you're providing for a family, the chronic stress of having to provide for your family, your children, your household, and we're talking basic necessities that we think of as luxuries: water, gas, fuel, energy. Imagine this. You're a single parent working 2 jobs, barely making rent, and your child gets sick. You can't afford to take a day off, but you also can't afford a doctor's visit. You're trapped. That feeling of there's no way out and feeling helpless that you can't help your child. It builds a lot of anxiety and depression, even despair. It's not rare. It's a daily life for millions of people. These are not just individual struggles. There are entire communities that are struggling with this very issue and have to bear the burden of this weight. Neighborhoods with high poverty rates are often to find fewer grocery stores, less green space, underfunded schools, and higher crime rates. These environments increase stressors that pile on. It's what we call toxic stress, a type of stress that doesn't go away and actually damages the brain and the body over time. This is what we mean by systemic oppression. But there's another layer here. It's not just poverty, it's inequality. It's not just about being poor. It's about the stark differences between the haves and the have-nots. Studies show that in societies where income inequality is high, mental health issues are more widespread across all classes, not just among the poor. When you constantly see extreme wealth next to extreme poverty, it feeds the feelings of shame, insecurity, resentment, and alienation of those feelings, especially over time, deeply impact our well-being. That was my own personal experience of growing up and where you saw your parents trying their best to provide a different environment for you, but barely making ends meet. And the stress of that alienation within your school environments when you don't have the things that you see other kids have or discuss access to things that you don't have access to. For instance, not having cable, kids would come to school and talk about certain shows like, oh, did you watch that on Nickelodeon, or did you watch so-and-so, and like being outside of the joke and not really understanding or not being a part of these conversations because you just didn't have that. And so you just had to use context clues or just like sit out of that conversation in order to still feel included and not make yourself stand out. Clothing is a big thing in school, which is why uniforms have become such a big popular route for education to go in to kind of neutralize some of those barriers that children have with fashion and being made fun of and bullied. We think about lunches, kids that have free lunches versus kids that have their lunches packed for them at school, and having those conversations and seeing those differences growing up. I cannot say that I lived in extreme poverty, but my situation was different in that we barely made enough to be in middle class because we were in lower class in a middle class neighborhood, barely surviving in that. My family relied heavily on Social Security, disability benefits, and things of those natures, and so we were very much on a fixed income. And so living in a middle class on that fixed income, we couldn't do the things that other kids could do. We were in schools that were completely underfunded for whatever criminal reasons, because I hear rumors about how our budget was spent. But Our education was not of quality, and there was limited activities and resources for our communities in our South suburban area, despite being in the suburbs. I started to experience anxiety from a young age because the fear of lack. There was financial insecurities that were instilled at very such a young age, going to food pantries and things of that sort, and fighting for food with your siblings and cousins and things like that. And so I got a job at 15 years old, in which I also was made to contribute to the household as well at 15 years old. And so that in itself caused a lot of ingrained traumatic responses with my relationship with money and finances that I still experience as an adult, but that I'm learning to work through with being able to trust more of my environment and of my stability, in a sense, and finding the balance of finances and financial education, financial literacy, and those things that we weren't taught growing up. So from a young age, it was constantly worrying about money, about whether we were going to move again, worried about whether or not I would have money for college. I saved up myself to go away to college. And I didn't even realize it was anxiety. It was just like, go, go, go. You have to make a life for yourself. And again, imagine thinking this at like 15. But I thought that was just life. Poverty is intricately linked to mental health issues. Individuals in poverty face increased stress, insecurities, and barriers to access to quality healthcare, which can exacerbate mental health problems as well. So what are some of the effects of poverty on our mental health? Increased prevalence of mental health disorders. Statistics show that individuals experiencing poverty have a higher prevalence of mental health disorders, such as depression and anxiety, as we just discussed. According to the World Health Organization, depression is 1 to 2 times more prevalent in low-income populations compared to higher income. Chronic stress and trauma. The persistent stressors associated with poverty, such as the lack of stable housing, food source, food insecurity, financial instability, that can all lead to chronic stress. The American Psychological Association reports that prolonged stress can contribute to emotional and cognitive deficits and difficulties. Barriers to accessing care. Individuals in poverty often face significant barriers to having access to mental health care, including lack of insurance, transportation issues, limited availability to mental health professionals. I myself, as a Medicaid provider, it's very limited individuals that are taking Medicaid sources, especially as a Black therapist within our own community taking Medicaid sources. A study showed by the National Council for Mental Health Wellbeing shows that about 56% of people living with mental illness will never even receive treatment. Poverty has impairment on childhood development. Poverty can adversely affect children's cognitive development and emotional well-being. Research indicates that children living in low-income families are more likely to experience mental health issues than wealthier peers. Think about how poverty can shape the psyche of a young person trying to grow up and develop in their identity and within themselves and their capabilities. A lot of their dreams and probably passions are muted because they're told what they can and cannot do because it's not a reality for them in their experience. Healing from poverty isn't just about receiving a paycheck. It's about healing the invisible wounds as well. Addressing poverty and inequality means changing a system that produces them, raising the minimum wage to a true livable wage, expanding access to affordable mental health care, building affordable housing, creating community spaces that feel safe, valued, and connected, promoting community. And on a personal level, it means checking our assumptions about poverty. It's not a personal failure, it's a structural one. We need to be pushing for policies that recognize mental health care as a human right, not as a luxury. So what are some possible solutions? Improving the access to mental health care, expanding public insurance programs, and providing subsidies can improve access to mental health services. Strengthening community-based services and integrating mental health care into your primary care settings, which can help reach underserved populations. Creating socioeconomic support programs. Implementing policies that provide for financial support for low-income families, such as housing assistance, food subsidies, and child care support, which can alleviate some stresses associated with poverty. The effectiveness of programs like SNAP in the United States confirms that financial aid improves both physical and mental health outcomes. Develop school and community-based interventions. Establishing mental health services in the school and the community health centers can provide early intervention and support for children and families. Programs like Head Start in the U.S. have had positive impacts on child development and well-being on the entire family. Promoting mental health awareness. Public health campaigns to reduce stigma and misinformation about mental health and encouraging individuals to speak up about mental health and seek help. Education and awareness programs can empower communities to recognize mental health and support affected individuals. Policy change and advocacy. Advocating for policies that address income inequality, improve housing stability, and increase employment opportunities, which can help reduce the economic pressures that contribute to poor mental health outcomes. Engaging policymakers in prioritizing mental health social welfare programs is critical. Overall, addressing the complex relationship between poverty and mental health requires a multifaceted approach that acknowledges the socioeconomic determinants of health and prioritizes equal access and care to resources. When we fight poverty and inequality, we aren't just fighting for economic justice. We're fighting for mental health, dignity, and hope. Thank you all for listening. I hope that you found today's episode meaningful and, again, educational and informational. You can always follow me, like, share, subscribe. Make sure to follow me on Instagram at Healing Crown Counseling. Also, you can follow me on Patreon. I have Sound Healing Sundays every Sunday at 8 p.m. on Instagram, as well as every episode airing every Thursday, Healing Not Healed, here. Make sure you can follow me on TikTok, Facebook, and all of social media. Again, like, share, subscribe. Thank you again for joining me, Healing Fam. Thank you.